So, assuming, since you hadn't heard any complaints about the study, that in the one or two conversations you had with Dr. Lazaroff during this time frame, he didn't express any concerns to you?
That is correct.
Right. And I take it that the conversations you had with him had more to do with going to Monte Carlo and making a presentation?
Okay. Going to Monte Carlo, that is correct. I think one time there was a discussion of the institute, the other continuing education, it was positive days in those days.
You mentioned it was positive, but obviously it was early, correct?
Yes.
I mean, at this point it was just about 1 year.
Right.
Right, and this was a 5-year study.
Right.
Okay, so talk about an institute and further continuing education. All was premised on the assumption that the study would go the additional 4 years and the results would be positive, right?
No. The critical, somebody was led to believe that if we got this one magic year, I don't know really how did that happen. As I told you, apparently implants, and I believe that clinically, my experience with them, if they're going to fail, they're going to let you know real quick, okay? And if they make it the first year, they're going to make it, although they may fail later, but the incidence, if they're going to fail, they're going to fail quick. That's my opinion, and then you could ask or read about it. Now, this, I even remember so vividly. I had a guest from the Atrex Corporation in my office at USC, and he was a periodontist, and Dr. Chi was sitting there.
I'm sorry.
Dr. Chi was in my office, and he made a statement, which was educational to me, because as you know, I'm not an expert in implant. So, said to me, he said, it is accepted in our circles, if they make it the first year, they usually will make it. Okay? And there was a periodontist, Dr. Stephen Garrett, sitting in that room.
Can you spell his last name?
Garrett. G-A. Garrett.
Where's he from?
He's from the Ethics Corporation.
And he's a
periodontist, very, very, very knowledgeable man.
Do you have some financial interest in Atrix?
I have stock options, 3,000 stock options, which is about 3 times $4,500.
Now, was this the first time that you heard anyone say that if implants last a year, they're basically probably going to last?
Yes.
Okay. But you had signed on to a 5-year study, right?
Yes.
And so you realized as a dentist that there was still information to be determined about patient well-being in future years.
Let me answer you this. 5 years is not enough. I think you want 10 and 12 years to have the best evidence is longitudinal evidence year after year. There's no question. However, implants today, after 20 years introduction in 1980, then the rules of the game are quite known now. Okay? In other words, everybody knows titanium is the best material. For example, everybody knows occlusion, if the tooth is hit hard, is very bad. Everybody knows restoration is the most critical in implant success and failure. So there are some premises already accepted in the dental field. Now let me tell you something else for your own information, which I think you should know this. My dear friend, implant is not a specialty. Implantology is not a specialty. It was rejected by the American Dental Association to have a specialty status. Implant can be done by any dentist who has a proper training. This is very important. So, if that is the case, that's the case. There are some rules developed from the inception of the implantology in 1980, what I call the modern implantology, these things are accepted. And one of them, apparently, is this thought, the 1 year thought.